When I was diagnosed with aortic stenosis, I hadn't a clue what it was. The only symptoms I had was chest pains, and I was getting out of breath, and I couldn't walk far at all. I'm in my 80s, and I thought it was the aging process.
This short film will explain what aortic stenosis is and what you can expect before, during and after your TAVI procedure.
Aortic stenosis is a heart valve disorder. It affects the valve at the exit of the heart between the main pumping chamber and the aorta, which is the main pipe, if you like, that supplies blood to the body. In elderly patients particularly, the valve can get sticky, can get calcified and restricted so that it doesn't open properly. When that happens, it puts a strain on the heart, and in the long term that causes heart failure.
Primarily a disease of the elderly, aortic stenosis affects up to 7% of the population over 75.
I started to feel breathlessness, and it got to the point where I couldn't even walk a few steps without suffering pain, which brought on the chest pains. It was very tough trying to climb the stairs. I couldn't do more than 2 or 3 steps at a time without getting out of breath. I went to my GP, who listened to my heart and said I had a heart valve problem, and suggested that I went to Derriford Hospital for examination.
Aortic stenosis is a mechanical problem, and therefore if the valve is not replaced, unfortunately the medication will not prevent the problem progressing, and therefore valve replacement is the most effective and only real solution to the problem.
You've been referred for a TAVI, that's transcatheter aortic valve implantation, a less invasive procedure for those unable to undergo open heart surgery. A new valve is inserted in the groin, fed up through the femoral artery and placed inside the old one. Alternatively, it can be inserted via a small incision between your ribs. This is called the transapical or transaortic procedure.
The introduction of TAVI has changed the whole landscape of treating this problem. This means that there's a large proportion of elderly patients who would previously not have received treatment and now have options for treatment.
So, Mr. Bowes, you've already had your coronary angiogram, but we need to do 2 more investigations before we can proceed. The first is a CT scan, and that is specifically to look at the vessels in your body and make sure that they're big enough to decide which route we can do the TAVI.
When I had a CT scan, I was told to lay on the table, put my hands behind my head, and the machine would run up and down my body, but I had to hold my breath for a certain amount of time.
The second test that you'll need is an echocardiogram, and that is specifically to look at the heart and the function of the heart and what size valve that you will need.
Once I was informed that I was having the TAVI operation, I asked a few questions on what would happen and how it would affect me.
You can see the wires from your previous heart operation that you had, which is why we're doing the TAVI.
The hospital organised the tests, and I had 2 tests, and they lasted about 30 minutes each time. And I was in hospital for about half a day. I was asked to attend a pre-assessment consultation where the nurse took swabs out of my nose, throat, and my groin.
Thank you.
She took some bloods, and afterwards I was able to ask about the procedure.
There we are, sir. Any other questions you'd like to ask?
I'm just a little bit worried about the procedure.
In your situation, we're going to make an incision in the side of the chest between the ribs.
Good.
A couple of weeks before you're admitted, you'll be sent details of what you need to bring with you to the hospital.
Are you happy with the door there, sir? Come on. You okay? Yeah, take it slowly. Go get your drink of water.
No, thank you, I'm fine. After I settled into the ward, the surgeon came to see me and explained to me what was going to happen the next morning.
So we're planning to do this procedure for you tomorrow morning, and as Sam had said, we'll do it through a small cut in the side. I think the cardiologists and the anaesthetists are going to come around and see you this evening and make sure that you're happy with the anaesthetic tomorrow.
Ready to go.
Good.
Thank you.
Hello, Mr. Bones. We're here to take you to theatre.
The following morning, the theatre team will collect the patient from the ward and take them to the cath lab where the procedure is performed, and will usually last approximately an hour.
Patient's on.
After the TAVI procedure, you will be transferred to either the CCU ward or the ICU ward for careful monitoring. You will remain there until your doctor feels that you can be transferred to a regular hospital ward, where you will continue to be monitored until your discharge from the hospital. Usually within 3 to 4 days for a transfemoral procedure, or 4 to 5 days for the transapical procedure.
The recovery period after TAVI is much shorter than with open surgery, as the size of the incision and the associated healing and pain is much less. Therefore, patients can return to a fairly normal lifestyle after just a matter of weeks.
When I got home, my wife was overjoyed to see the difference in myself. And she was very pleased that I'd come through it so well. I felt like an 80-year-old going down back to 40. I could do a lot of things that I couldn't do before. Walking, no breathlessness at all, no pains in the chest. Everything was fine.